A case of recurrent retinal detachment under silicone oil with a persistent macular hole. This patient operated twice before. The first primary surgery operated elsewhere with no report about the original cause for vitrectomy. The second surgery was a repair of retinal detachment and the macular hole, which repaired by inverted flap eye lamp build and silicone oil injected. This is the third surgery, which started by silicone oil removal and the easy wash of the silicone bubble. A brilliant blue stain showed a wide area of eye build and the epiretinal membranes. Dissection of the epiretinal membranes carefully. Now, how to manage this macular hole, which a large, recurrent, and no eye limb. So, retinal graft decision taken to close this large macular hole. The selected area for the graft in the upper peripheral retinal area, and a stained area by a brilliant blue as a marker to show the graft inner side from graft outer side to avoid graft flipping. Less endolaser or diathermy to avoid graft necrosis. By manual dissection of the graft in a detached retina to avoid a choroidal trauma and bleeding. Move the graft under the PFC while the harvesting area under the PFC also. But if the harvesting area not under the PFC, move the graft without PFC over the macula to avoid graft floating. But you should stabilize the graft while injecting the PFC. Careful graft centration and should insinuate the graft edges under the macular hole edges if possible. This is 1 week post-operative image and 3 weeks post-operative image and some improvement of the visual acuity.